a State of the Science Conference on Research and Technology for Blindness and Low Vision, held at Smith-Kettlewell on December 4th, 2015. Highlights from a day of discussion and idea exchange among experts, consumers, and other stakeholders.
Panel 2, Challenges in Community and Daily Living. What are the research needs and opportunities? Anita, Shafer, Aaron.
The people that still, in many ways, are the hardest for employers to figure out how to accommodate without assistance are people with visual impairments. And a lot of it has to do with getting, once in the workplace, once you've dealt with the steps and all that, trying to take what is, in many cases, a very sighted environment and adapt it continues, even with technology, to be an issue. There's a big difference between, say, whether a smartphone has speech and whether a person with a visual impairment feels competent, even after training, to use that technology.
Ian Bailey.
I would like to see more tests around to look at some of the more sophisticated aspects of mobility and reading performance. There are just a whole bunch of new tests that we require to understand the complexity of motion beyond the contrast sensitivity and visual fields that we have at the moment, and same with reading.
Linda Myers.
So they need to know what to ask for and who to ask. That seems to be the issue. What we don't oftentimes have is the lead time to sort of make these teacher-made materials accessible. The textbooks, they have the charts and the graphs. The text is usually not a problem, but it's the charts, the graphs, the maps, those kinds of things. And a lot of times, technology can help, but I spend so much of my day, every day and evening, preparing these materials.
Robert Wall Emerson.
We're all pedestrians sometime. We all travel through an environment. But for the longest time, as O&M instructors, we didn't really think about interacting with the environment to make it more inclusive, more accessible. We talked about how to teach people the techniques to travel through the environment. We need to figure out, and people have talked about this already, we need to figure out how better to get what we know out there so people can use it. But we have to do the opposite as well. We have to be able to go out to related fields and canvass them for useful information that applies to what we're doing and leverage that so that we don't have to reinvent the wheel.
Mike Cole.
We got to always keep in mind that being independent is hard work, and folks lose motivation. If we show somebody something in living skills, a lot of times just once, they'll have it forever.
Lainey Feingold.
Now we're trying to get as much accessibility in healthcare as we can, mobile apps, not just IoT like Paul said, but one of the things when I talk to audiences that don't know our issues, like ingestibles, where people can find out information about their own bodies. And if that information is not accessible, oh my God, how awful is that?
Dianne Pawluck.
There's so much research now being poured into indoor localization for advertising. I think it's a really good time to jump in and work with them before they go too far and they're not thinking about all the other things they could be doing with this and making it a little easier so that, as prices go down for advertising, there's still access so that we could use it to inform people about what's around them and things like that for people who are blind.
Lucia Greco.
How many people have been to a gym lately and seen that the machines are all digital for your weight machines now? You can't program a weight machine. I can't go to a gym independently and use a weight machine because I can't figure out, if that's 100 pounds or if that's 500 pounds I'm putting at the end of my arms. I think that the access I had to recreation and physical activity as a younger child is what made me a very successful blind person. And I think it's not everybody's going to be a stellar athlete. Not everybody's going to be going out there and doing things, but we all have to have the access to it to make us the fullest, roundest people we need to be.
Joshua Miele.
The two greatest innovations in independent travel for blind people in the last decade has been the broader distribution of real-time transit information, so things like next bus and knowing actually when the next bus or train is going to come, and also the transportation network companies, companies like Lyft and Uber are, if you've got the money, truly transformative in terms of independent travel, and I think I see that as pointing in a direction, not as an end. I think that we're moving towards a world where networking and information distribution is going to significantly impact our ability to get around independently.
Ting Sue.
We've been talking a lot about access to information by people who are blind, but the same issue remains for service providers too, is for us to have access to information on the newest stuff coming out and the newest tools.
This meeting is supported by NIDLR Grant 90RE5008-02-00 and Smith-Kettlewell. The views expressed in this meeting do not necessarily represent the policy of NIDLR, ACL, HHS, and you should not assume endorsement by the federal government.